Let's see, it's 7th April 2018. Hi, everybody. It's Dr. Jines. I got some questions about the verbiage I use during exams and why I vocalize everything I do. And it gave me pause to think for a bit. And here's my random thoughts on it. The exam is the one time you get to really make an impression. You know, they don't know what your work looks like. They don't know if it's good or bad. But that exam is that one time you can build a relationship that can last a lifetime and help you avoid ever getting sued. And that's one of the reasons why I do that. The other reason is simple. You'll hear commercials all the time saying that X dentist is the best, the fastest, the whatever. And it occurred to me, you don't hear a lot of that in the medical community. And way back when, the old saying was that in medicine we graduated colleagues, and in dentistry we graduate competition. So if you really want to make a good impression on that patient and do them a real service, you can't go wrong by being thorough in your exam. And people don't always recognize or appreciate an exam. I've been in the emergency room treating patients with nondescript abdominal pain, and I look and we get done, we write them a script, and because it wasn't a surgical procedure, because they weren't admitted, you'll hear, oh, they didn't do anything for me. Same goes in dentistry. A patient comes into our clinic and they've got a complaint of a toothache or some pain. It's not acute, but it's there. You do the exam, we treatment plan what they need, we send them on their way, and you'll hear them say, well, they didn't do anything today. So they don't value that 14 years of training I had to get to the point where I can make a decision in just a few seconds. And that's why way back when I started to verbalize my exams. And the way you can tie your exam in from a dental exam to medicine is simple. The most common infection of all mankind is cavities and gum disease. And it's an infection caused by bacteria. We know in our medical literature, it's replete with examples of how dental flora becomes systemic, whether it's in heart valves, whether it's in the brain, whether it's related to ankylosing spondylitis in the cervical spine, which is a type of rheumatoid arthritis, or patients that have had adult onset asthma and they've got chronic gum disease. And some, luckily there have been a few astute physicians that have cultured and found, and we now have examples of people with adult onset asthma with rheumatoid arthritis that have infection instead of the way we treated everything before, much like the earlier example I gave you where your immune system attacked your body and it turned out the person with a stomach ulcer didn't have emotion and a faulty immune system. The immune system was actually attacking something. In the case of the stomach ulcer, that was HTLA-B27, which is a protein that's on the outside of Helicobacter, which is also the same protein that lines your stomach. So your immune system doesn't always get up Monday morning and get stupid. And that's a topic for another day. But as far as the exam goes, I had a question about that verbiage. Why do I ask? Do you have lumps, bumps, pimples that don't seem to go away, ringing in the ears, blurry vision, double vision? It's because every one of those things can be related to infection. Every one of them can be related to your teeth. We've had patients that have had cavernous sinus thrombosis or a retropharyngeal space infection from a peritonsillar abscess that comes from, which started as pericornitis around number 17. And so you can tie so many things into your dental exam as far as we're looking for tumors. This was tumor week, but it can also be infection. And a great example of that is infertility. The leading cause of low birth weight babies, of spontaneous abortion, miscarriage, and infertility is infection. We have a whole specialty in medicine that can charge you $500,000 to get you pregnant, when many times the male and female just need to be treated with antibiotics for a week and they can go try it and get pregnant. And so my questions, do you have burning and belching and heartburn? Do you have a chronic stuffy nose? Do you have spotting between periods? Do you have bloody toilet paper? Do you have frequency of urination at night that makes you have to get up several times to pee at night? Those are all asking. Do you have an infection? Do you have bleeding gums? You have an infection, and it can be systemic. And that's why I asked those questions. And then the verbiage was simply, I talk about the anatomy, from the extraoral anatomy, the cranial nerve deficits, all that. Then the patient hears, and since doctor means teacher, I'm teaching them not the anatomy, but I'm teaching them a valuable lesson. I'm doing a really good job, and where that'll play out, or you'll hear it when you have other physicians and other dentists say, well, that's the most thorough exam I ever had. When you have your patients say that, then you know that you've got something, and you're actually building a relationship where they value you as part of their healthcare team, and they'll probably listen to those treatment plan recommendations you make. So from a non-altruistic, but from a business standpoint, it just makes a lot of sense.